in health and wellness presentation. This is a presentation on preventive and restorative healthcare, and it's on Facebook Live. Today we present the topic titled The Prostate and the Other Room Matters, Resolving the Matters That Matter. So, what matters matter about a man's prostate? That's what today is all about. Well, the main matter that matters about the prostate is that tube that passes right through its center, draining urine from the bladder and also draining semen out of the tip of the penis. This tube passes right through the center of the prostate, and when the prostate enlarges, it constricts that tube, as you can see from the image there. And that's one of the major matters that matter about the prostate, because it compresses that urethra, and by merely compressing it, it is the root source of so many of the health challenges of the prostate. And that usually happens in men who have neared or have attained the age of 40 years old. As you can see from that diagram, from a normal average mature prostate size of about 20 grams, it can enlarge to over 5 times its normal size. That's over 100 grams. Well, what are the problems associated with the enlargement? There are 3 types of disorders. We talk about it. We look at the symptoms and we look at the solutions that we have to prostate problems. The first thing we want to talk about are the major disorders of the prostate. The first is an inflammation of the prostate caused by an infection, and this type of disorder is called prostatitis. The second one is BPH, benign prostatic hyperplasia. That's the non-cancerous rapid multiplication of the cells of the prostate, which leads to an increase in its size. And the third is the growth of abnormal cells of the prostate. That's the prostate cancer. Well, let's look quickly at them. We mentioned the first one, prostatitis, caused by bacterial infection, although there are some other causes, and then can be transmitted through sex, passes through the bloodstream, usually in men from about 25 to about 40 years old, especially men that have a history of STDs. The second one is for we older men. This is the one popularly called prostate enlargement, where the prostate enlarges in size and it compresses that tube that passes through a center. The third one is the growth of cancerous cells of the prostate gland, and this has led to the death of so many Nigerian men. Now let's look quickly at the common symptoms of prostate malfunction. One unique thing about all of them is that they start very slowly, in most cases unnoticed, but as soon as they start, they have a tendency to rapidly deteriorate. So we group them into 2. The first one are the bathroom symptoms, that has to do with urination, and the other one are the bedroom symptoms, which has to do with malfunctioning in the other room. So let's look at the first set of challenges of the bathroom. They're called voiding problems. That has to do with the exit of urine from the tip of the penis. The first one of these is the pressure flow problem. This is caused by bladder outlet obstruction, BOO, where the pressure of your urine gradually weakens. For some men, they experience delays to start, hesitancy, they call it, or delays to stop, terminal dribbling. The terminal dribbling leads men that are old in age, probably from 40, 50 and above, to ring the bell, if you know what I mean. Then we have unusual patterns where for some it comes with urgency. They cannot hold urine. They just have to go and pee. In some, they experience an increased frequency of urination, especially overnight. That is known as nocturia. For some, they have multiple urine streams. Some, their urine comes in spurts, cannot come in one smooth flow of urine. Some experience pain, tingling sensation, discomfort before, during, or after urination. For some, it comes with excruciating pain. It gets worse. When the infection sets in, they experience lower back pain. Some, it becomes excruciating, becomes the chronic pelvic pain syndrome. In some cases, it gets worse, becomes the acute pelvic pain syndrome. And for some, they experience pain in the pelvic region, around the shaft of the penis, around the scrotum, around the testes. Well, the worst case scenario is when they start experiencing bladder storage problems, when the bladder cannot hold urine anymore. The bladder muscles have been overstretched with an increased volume of urine. That's a bladder that's supposed to take about 35 cl worth of urine is forced to now take 2 liters or more. Why? Because urine is trapped in the bladder. Such men experience urine leaks or involuntary urination, where they cannot control urine, so they now have to start wearing diapers. In some extreme cases, they have wounds inside the bladder or inside the prostate, which leads to bleeding, and they release semen that is mixed with blood. It's called hematospermia. In the worst case scenario, the trapped urine forms crystals, because the minerals in the urine will crystallize and the crystals become stones, and the man experiences severe bladder stones, in some cases kidney stones, and this blocks the outlet completely, and such men cannot urinate naturally anymore. They now have to be operated on, and a scientific apparatus passed through their penis into the bladder to leak out urine. Now, this is when the shit really hits the fan, like the Americans will say. Well, the problem now continues in the other room, and they experience frequent power failures in the other room. I'm sure you know what I mean by power failures, where the staff of office no longer responds to madam. And you can see madam's mean look there when the man loses his sexual urge. His libido drops drastically, and him and his partner become at best roommates. Well, in some cases, he becomes like Usain Bolt in bed, even faster. They're done in 2 minutes, just like the noodles. Are you experiencing any of these symptoms? If not, would you wait till you experience them before you do something to protect your prostate? Once you are near or have attained the age of 40, you fall under the vulnerable group of men. Take proactive measures now to protect your prostate. If you will not wait until your car's cooling system packs up, you know that you have to do something about your cooling system. Well, why wait then till you start experiencing symptoms? We'll advise you to get in touch with us for prostate solutions. Our solutions come under 3 main areas. We first of all work on your diet. We have in-house nutritionists that will help you with the right meal plan that will help you maintain optimum health for your prostate gland. Then we will advise you on adjustments you need to make in your lifestyle. And finally, we will recommend the right nutritional supplementation that contains the nutrients that your prostate is lacking in, that causes a malfunction. And these supplements will put back those nutrients into your system, and your body will heal itself naturally. These are the 3 sure ways that we know to prevent or to resolve prostate problems. We did not forget the fourth one. It is just not in the list of our options. We're talking about prostate surgery. Please don't wait till you have to be operated on. A surgery of